Hello everyone, this is Dikshak Bhatt from Team OYG. On behalf of our team, I welcome you all in this again another virtual naturopathy talk. Today we have a wonderful speaker all the way from USA, Dr. Maria Jose, and we would like to welcome you, ma'am, on this virtual platform again with us. Dr. Maria ma'am has completed her educations and Master of Science in Acupuncture and specialty in human acupuncture and Doctor of Medicine and Surgery as well. She has lots of experience in the field of medicine and surgery. She has done as worked as a medical writer at learskin.com. She is also co-founder and lead practitioner of a QI Med. She is also a lead acupuncturist at hospital and assistant oncology surgeon with the Dr. Victor. So she has done a vast experience and she can guide us through a very much beautiful and another interesting topics. She has done a lots of voluntary work in the country of Mexico and the Kenya. And right now she has continued educations as well. She is still learning and she holds the certification of BLS, certification of VAC, certification of ALBS, also education in palliative care and advanced oncology acupuncture and the clinical research and symptom management. Ma'am, you have such a great profile we have right now, and we hope that we could utilize your knowledge and session with us. Thank you so much, ma'am. I hope I haven't missed anything from your introduction, and if I missed, then I would apologize for that. So, ma'am,
Oh,
without
no, no,
further
no.
ado, I would like you to take over.
Thank you. Thank you so much for inviting me, and I'm very happy to be here. Um, Everything in paper seems a lot more bigger than it is. It's actually all of you will have the opportunity to be, um, increasing your knowledge throughout experience once you start learning. But um, I've had the opportunity to study my specialty in acupuncture in Mexico and then continue my studies in the US. Um, and I guess that was for me, it kind of opened my eyes of what acupuncture is in different scenarios and in different worlds. Because when I was studying in Mexico, I was told about acupuncture in China, right? And how beautiful it is in China because everyone has it in the hospitals, right? It's part of the way they heal, that you just go to a normal hospital and they have herbs and they have acupuncture as well as they have the other specialties. And we don't have that in Mexico, right? So I was always told about that. But then I come to the US and they actually don't have that as well. So we're struggling. I think we're growing. I think the only place that I know they have it is in actual China and in some parts of Europe, like in Germany. I know that in Germany there's a lot of hospitals that they do acquire acupuncture and they have acupuncture clinics as part of the hospital care. And so I think that was a big change for me in the idea of that acupuncture was growing in the world. And I still think we have a lot of work to do in that area.
Ma'am, you have such a great profile and you have visited so many countries. So, according to you, what is the future of acupuncture you seem right now?
So I think the future is, I do see that we're growing for sure. Acupuncture is growing worldwide uh, because we have this, we're going back to this natural trend, right? Everyone wants to be better and wellness is related a lot to natural. And we can relate acupuncture and Chinese medicine to natural healing, right? But even though that trend is growing, um, the future is going to be in the hospital and clinic care, I guess. I think that is what we want to see and that we will see in the future, that acupuncture comes in this integrative healthcare system, that we all provide a little bit of everything with our specialty and with the other specialties. And I think that's why I entered in the oncology area, because oncology, from what I've seen in my personal experience, is the area that everyone is willing to open a little bit their minds. And I think that is why acupuncture has gained a lot um, of steps there, I guess, because people want to get better and they want to open doors for the patients that are suffering, and it's a disease that it's consuming worldwide, right? So I guess they opened the door to acupuncturists, and it was a great idea. And I know that in Harvard and in Johns Hopkins they have acupuncture areas, but we just need to see it in a more broader area. We want to see it in every hospital. We want to see it grow in every hospital, in every clinic. Just not. I am not satisfied with just having acupuncture clinics all over the world, tiny clinics. I think we're going to see more of acupuncture in the integrative healthcare.
Yeah, ma'am, I will totally agree with that. If that is impossible for the future, then I think acupuncture is the treatment that everyone should try first before getting a medicines.
Of
So
course, you're
even
totally
myself
right,
is,
Sam. You're
yeah.
totally right. That's the idea. I always tell patients that because you and I know it because we're studying it, right? And we're in the kind of like we're interacting with those ideas every time. But you always have to think about the people that are not in contact with Chinese medicine, and you always have to share your knowledge and share what you know. And the thing that I always say to them is you need to first experience something that is non-invasive, and that is habits or something that you can do at your house, because acupuncture is also acupressure. It doesn't have to be the needle insertion. um, and so we have to take this as a habit. We have to take this to the people out there and tell them, you know what, the steps of healthcare need to be: first you take care of yourself, you you know yourself, you get to know your body with prevention, and then if needed, then we go steps forward. But I think that's a very important thing you said there.
Yes, ma'am, totally agree with your points. Ma'am, what learning experience you have during the clinical journey? Because as you said that you have worked with an oncologist, so your clinical duty with cancer patient, what is your learning experience?
So I think this experience is one of the most valuables I've had in my career, because once I started studying acupuncture, I didn't know, or we were not fully trained in subspecialties. We were trained in broader acupuncture. And in our last year, we had the opportunity to go to a clinic in Mexico that was treating cancer. Not treating cancer to cure it, but we have to be very clear about this. Uh, Acupuncture does not clear or save cancer patients. It is specifically for purposes of quality of life and reducing symptoms. I know that there are some very special trained Chinese medical Chinese people in China that can reduce tumors, sizes, and tumor markers with herbal medicine, but not with acupuncture. Okay. And so once we said that, uh, I was trained in acupuncture and oncology acupuncture further because I was really intrigued by this. And I think this is where I'm going to repeat myself, that oncology acupuncture, which you can now study it as like a subspecialty in Memorial Sloan Kettering Cancer Center in New York. They now actually have the online course. If you're interested, go there and research and just open your idea to it, because it's very helpful, and you're going to find cancer patients all over the world all the time. And cancer patients are very delicate, and they don't have energy, and they lack of energy, and they have nausea. And this is where we come very strongly. Acupuncture can come very strongly helping out those patients where Western medicine cannot. And so I think that is a very important clinical opportunity for us to stand um, in the world of hospital and clinic, very important areas that we can provide a lot of ease where other doctors cannot, because we can definitely promote energy, we can definitely promote sleep, we can definitely promote or alleviate pain, alleviate nausea, alleviate peripheral neuropathy, where those patients have a lot of peripheral neuropathy because of their treatment. And we can also reduce stress. So we're talking about an overall quality of life, a better quality of life. So that is the clinical area that I think we can be very strong at. Um, and in general, it's not only for patients in oncology, but it's in general area. Imagine patients that have been hospitalized for 2 months. We're not talking about cancer, we're talking about anything, any pathology that keeps them there. They're kind of stressed, depressed, they're feeling anxious, they have low energy, maybe they went through surgery. So I think Chinese medicine and acupuncture have really potential there in the clinical area. So I think that's my experience there would be in oncology preferably, but also in a general scenario.
Ma'am, as you said that the cancer and the acupuncture. So regarding your views, I wanted to know, can you just give more information about the acupuncture and the cancer for the treatment purposes? Because even my aunt is just diagnosed with the cancer, esophageal cancer. So that is why I wanted to ask this question particularly.
Yeah, so from what I know, as I was saying, um, herbal medicine, and you have to be very careful with this because the person that you go see has to be very knowledgeable, and has to not not always, but most of the times has to have a medical background, because and this is where it gets tricky, worldwide acupuncture and Chinese medicine, because I know, because we like in Mexico, to get acupuncture specialty, we have to be licensed, medical, like we have to be we all have to be doctors. So it's a specialty. Rather in the US, it's not a specialty, you don't have to be a doctor, you just have to have like the natural science and biology pre-med, I guess, and then you do a master's. But if, in my opinion, if you want to be like a master, like a very high quality provider for oncology in Chinese medicine and acupuncture, in my opinion, I would totally recommend a medical background so you can understand both worlds, because your patient is most likely going to be treated with chemotherapy and a lot of medication that you need to know. And so you have to be familiarized with it. And also you have to have a very strong background in herbal medicine and acupuncture. You have to be very agile and very knowledgeable to combine those two areas, right? So the Chinese medicine and the Western medicine, in order to give your patient a better treatment. So in cancer specifically, as I was saying, the only way to treat cancer would be with herbal medicine and lifestyle, right? Um, I am not an herbalist specialist, so I wouldn't even know where to start to talk about herbs for specific for cancer treatment. My specialty is for quality of life and the symptoms, which I already said about the Memorial Sloan Kettering Cancer Center, which is all. What is beautiful about that course is that the Memorial Sloan Kettering Cancer Center does a beautiful and terrific planning, because it gives you scenarios like specific acupuncture points protocols for specific symptoms that have been evidence based and have research, so you don't get lost in the way of, oh well, I decided that the specific patient has wind invasion or cold or whatever you diagnose this patient with. Sometimes translating that to Western medicine is very complicated. And so what they do is they just give you a prescription of, this has worked during a lot of years, and because of research, we know that this prescription of works. And so you kind of like work from there. So in cancer specifically, I would say get get a lot of knowledge in herbs, but be subspecialized in cancer, because it's a whole nother world. It's a whole nother world to be specialized in herbs for women and for hormones that it is for cancer. And um, specifically in acupuncture, also be subspecialized, right? You're gonna already know a lot about this because of your previous training as a general acupuncturist, because you know all of this. You know how to bring energy, you know how to aid with sleep. All of this you will know, but it's just a general, more organized perspective. And you talk about contraindications, when to not put needles and where to put needles, because there's a lot of patients out there that will have a lot of medication that maybe it's contraindicated because they have blood thinners, or you need to know when and where and how. If they have chemotherapy, there's a lot of timelines that you need to respect there. There's patients that have nausea during chemo, there's patients that anticipate the nausea and have it before even their treatment or after the treatment. So you have to be very precise on your acupuncture treatment, if you do it twice a week, during or after or before the treatment. So it's a little bit complicated, but it's very easy once you get into it. And so going back to the first question that you made, is also um, where is acupuncture going? I think it's also knowing that we have also subspecialties. We as acupuncturists need to also, we know all about the body, and I think that's the beauty behind Chinese medicine, that we integrate it as a whole, spiritual, mind, body. And I think that's the power behind Chinese medicine. But it's not bad, or it's not a defect to also be subspecialized or know a little bit more about what you want to dedicate your life to with your patients, right? So if you want to be in pregnancy, well, do more of that, so you can know more, a little bit of hormones and a little bit of medical background, so you can also speak the same language as the other doctors. That is super, super important, to know the language with the Western medicine, so we can be growing at the same time and have more power in the medicine as a group.
Yeah, ma'am, I will totally agree with that point, because if we are, to right now there is less awareness in the acupuncture, so it will help to aware the acupuncture of the patients, because people have a less faith and natural medicines and everything, and they have vast faith on the modern medicine, but they doesn't understand the other effects, side effects that they are giving. But acupuncture, it will help us as we, the build rapport with, as you said, with the doctors, others. We need to keep ourselves up growing. Ma'am, another thing I wanted to ask is, as you are highly active in the community work, so what motivates you to do this? Because this is not a easy task, I feel. This is the hard task. So,
Um, well, that's a difficult question. It's not difficult. I just don't know how to explain it, because I think if you are involved in medicine, in any type of medicine, whichever type you decide, which in an ideal world should be only one medicine, right? Which is to feel better and to, we as doctors, we want the patient to feel better as a whole, right? We're not talking about just physical. So that would be an ideal world. But talking about the world we live in, that medicine is divided in Ayurveda, Chinese, and Western, and a lot of other medicines. Um, I think that we are all trying to make a better world and to help, right? And so I think that community work and community service just, it sparks within you. Like it's just something that you naturally have. And I think that there's a lot of people out there that do this, but I think that doctors, if you truly have that nature within you, it just comes natural, right? Because you're always trying to help and you're always trying to see what can you do to help communities that maybe don't have a doctor, or that maybe lack of a medical care. And so I think the answer to that question is that it just comes natural. And the thing that I do is that I try to take the time and accomplish it in my lifestyle. I think that's the key of what you have to do, because we all have dreams and we all have wishes, and we all maybe desire to help people, but it stays as something that you want and not action. So the only thing that I would say is just take action by planning it within your schedule so it can fit your lifestyle, and just make it part of your lifestyle. Just make it part of your, maybe you cannot do it every day. I cannot do it every day. When I was young, I could do it during vacations. So that's what I used to do. I used to go for months or weeks just to go help out a community. But now that I work and now that I study, and schedules change, and we're busy, which is fine because we're starting to get better at what we do, right? And so what I do is I try to schedule some of my appointments, maybe to help people, or maybe another vacation, and maybe throughout the weekend, if you don't work, if you're, there's some people that work during the weekends, I don't, but sometimes I would offer, my weekends for that. So just try to find a place and a time, a space to do it, so you can accomplish that work.
Ma'am, as you have done so much of voluntary work, so regarding that, my question is, what type of challenges did you face in the working in rural areas, especially? Because rural areas is a tough task to, as you have traveled so many and you have done so many voluntary work, so challenges must be there. So can you just give us a glimpse of that?
Yeah. So I think there will always be challenges if you want to do very rural work, as I used to do when I was younger. Um, but I'm gonna give you two examples of this. And because people say, oh well, they imagine rural or community service as a type of personality that you go like to, I don't know, a World Health Organization or something like that. And yes, you can do that, and I would totally advise you to go with an organization and not by yourself, because you will encounter a lot of problems, especially if you travel. So there's also the culture, and maybe they speak another language, or the dial, whatever. So make sure you go with an organization or an association that it's settled and it's recognized. I did that, and it's a lovely experience. It's a beautiful experience to get to know a local community and to help. And I think that's the easiest way, because everything is organized. But if you want to do it by yourself and you don't want to travel or whatever, I think that it's just paying attention to your community, because um, I think that would be the the option that has less trouble, I would say, because rural and community work, you encounter a lot of people that sometimes receive you very happy, and you're like, hey, I'm here, what can I be of service, I want to help. And people sometimes they don't like it, or maybe you don't have the cultural background to have that connection. So I would say that's a very difficult situation, um, that I've encountered. And also maybe just, yeah, just like cultural interactions, I guess. And also bear in mind that you are going to set a goal in your mind, perhaps, that you're going to help. But then you get there and you have this plan, this perfect plan. First, I'm going to do this, and then I'm going to deliver acupuncture, and then, but sometimes plans change, and sometimes the community needs other things that you thought they needed. And so just be very flexible, and keep in mind that you're there to help and not to fulfill yourself. And so if you were there to provide acupuncture or massage or a talk, and at that moment it rained and they needed help with construction, well, that is what you're going to do that day, right? So just keep in mind that you're there in your experience to help and to provide service, and that is what you're there for, not for your schedule, right? And I think that's a very special thing that also comes within when you want to do that type of service in community and rural service. But if you want to do something more of your daily life, I just tell people, just open your eyes, because you can actually help a lot of people around you. There's a lot of homeless people out there. If you don't want to interact with homeless people, which could be dangerous, I totally get it. But there's also associations, local associations, or clinics or hospitals that need your help. Maybe you can donate 2 hours of your week or 1 hour of your week, or go visit children. It's just finding the time and space. But I think you will always encountered challenges when you're trying to do that. Just go with the flow and remind yourself as a mantra that you're trying to help, and that is what people are gonna like be thankful for. And always have a
Ma'am,
smile on your face, because there's gonna be a lot of problems.
ma'am, you have such an inspirational story, and you are such an inspiration to all of us. So, one thing I would like to ask that what made you first that connected with your acupuncture? What are your journey with an acupuncture? How you connected, when what the spark that comes that leads you to acupuncture?
I guess the power of acupuncture, of healing. I guess it sounds very weird, and it sounds kind of like magical, but it is. I came from a very westernized and evidence based and science based background from my medical background. And I was into surgery. And so I was not in the idea of natural medicine. I was not, I did not accept that medicine because I didn't know it. And once I encountered Chinese medicine, I I just fell in love very quickly because I saw what it could do. And I think what I love the most about acupuncture is just the theory behind it. Chinese medicine has this and how they take into context all the emotions, like the liver and what it does and how the energy moves. I It just all makes so much sense, and it makes a better sense to me than it had before. Than just like going organ by organ and like system by system. Whenever I heard like kind of like this story narrated, and just whenever I heard about the TCM basis and how it all comes together, and the diagnosis and tongue and pulse, and how acupuncture is just stimulating your own body, it just makes my mind blow how you can actually, I don't know, it's like a superpower. It's just like self-healing, right? Because it has qigong, it has meditation, it has movement, tai chi, it has herbs, it has acupuncture, and it has all this theory behind it, that it's very beautiful, but it's also so old that it makes it very powerful, because it's been evidence based in another way that science knows it, right? So it's been generation through generation, but that doesn't mean that it's not science based. If I'm being, I don't know if
No,
I'm
ma'am,
being
it's
totally
you are
explicit with this,
perfectly on
but
point.
yeah.
Ma'am, as in your profile, I have seen that you have visited so many countries. So, what kept you going? And you are still learning. So, even myself, I'm finding sometimes studying is hard. So, how do you deal with this kind of situation? Because you are keep on going and going. So, it's such an inspiration and motivation. Because if I even myself, I would try to get you in the point at the point as you are right now. So I will see in future if I can just touch the point of 5% of your profile. So
No, so I think what drives my studying is just the patients. It's just there's sometimes when you get to the clinic. Are you in clinic right now? Are you in contact with patients, or are you just in your first years?
no, ma'am, I'm in the final year right now, so I'm just doing
Final
the
year,
last year of
perfect.
it. Yeah.
So I think that once you start the practice and you start encountering yourself with problems, right? You're like, oh, this patient, he's very difficult. I don't know the diagnosis. I don't know which treatment would be better. Maybe moxa, maybe this point. And I think that struggle makes me want to learn more to provide better service, right? Because what I don't know and what I don't provide is going to affect directly my patient, right? So what I would say to you and your colleagues is just find an area that you love. And that's what I was going with cancer and hormones, or like women health, or I don't know, maybe thyroid disease, or I don't know, whatever, arthritis or whatever. But I think it's very important for you to thrive and to drive your knowledge to a specific area that really resonates with you. I don't know. I did my thesis and I studied 3 years of Parkinson's with acupuncture and quality of life because my dad was diagnosed with Parkinson's, and that resonated with me at the time. And I started seeing a lot of patients, and I started to see an improvement in their quality of life. So that felt really good. So as long as you feel the desire and that you feel really good about a specific area of your medicine, I think that will always keep you going on the learning experience. And you don't have to seek for advice. It will just come within because you're wanting to more know and to help the people.
Said that's as you said about the patient. So how would you build your rapport with the patients? Because this is also a main thing, and you have such a great experience. So we would take note of that points if you suggest
Of what? Sorry?
how you build your rapport with the
Could
patient.
you repeat the question to the patient? Provide what?
Rapport. How do you build the relations, and how do you get with your patient, get along with your patients?
Oh, okay. So I think it's all experience and failure. I think it's for me. I've learned a hard way, I guess. I had a mentor who I'm really grateful for. When I was in surgery, he took me like under his wing, and he taught me a lot about managing and taking care of a private clinic. So I learned a lot from him. And I think that really helps because when you're starting to open a clinic, there's a lot of things going on. But specifically with patient relationship, um, I have to say that in Chinese medicine, just by learning Chinese medicine, you become better at talking to a person, because Chinese medicine also gives you the tools to connect with yourself, and connecting with your emotions. So just by that first step, if you have Chinese medical background, I have to say that you have a better relationship already with your potential patients. And second of all, um, I would really recommend to always be super open. Um, Super open in whatever comes. Like if it's a patient looking for whatever, just be open and say, you know what, I can help you with this, or I cannot help you with this, and be super honest and know your boundaries and know what you're good at and know what you cannot provide that person. So if a person is looking for a psychiatrist and just wants to talk to you, and he has a severe depression, and he is just not wanting to get a medication, but he wants to get natural medicine or acupuncture, you need to be very strict with yourself and know your boundaries and say, sir, I can help you with this, but I cannot help you with this. And as complicated and difficult as that sound, the person is gonna appreciate it a lot because you're looking out for their health. So being honest and open and knowing your boundaries, I guess, is a very good thing. And the third thing is that it's also provided, I guess, alongside with Chinese medicine. Don't be afraid of being late with another patient. So take the time to listen to their problems and to really connect and engage with the conversation and make them feel that your five senses, not only listening, are with them at that moment. So when you're interviewing a person and they are opening their private life to you and their personal problems, which you don't know, but maybe it's the first time they're sharing it. So if you don't know that, just have the capacity to be very human and very connected with that person. Because if for 1 second they feel that you're not interested or that you got distracted, that will literally break the relationship. So make sure you're you're practicing your own mindfulness and being present in that moment. Take your phone away. I personally, what I really like in my experience is not having my computer. I do not take notes. So I just go, I talk to the patient, and I try to remember as much as I can. If there's a lot of information of, or maybe there's a lot of medication or a lot of medical history background, I have a paper with me and a pen, and I try to keep eye contact and just write specific bullet points. And then when the patient is lying down with the acupuncture needles, which is a lot of time, then I go back to my desk and try to write it down from memory and from my tiny little notes. For me, it works. I know there's a lot of people that are going to say, like, I don't have that memory. If you practice mindfulness year through year in your own experience, you're going to develop that that tool that I can say has brought a lot of connection for me with my patients. So I don't know, try it out. And if you like it, just
Sure,
continue with
ma'am.
it and practice it. And if not, just, I guess you can start doing your own tricks just to try to stay focused and engaging with the conversation.
Sure, ma'am. And we will definitely go with another tricks, but your tips will be helpful, really helpful for us because as you guided us. And one thing I wanted to ask here, as right now there is a current situation is COVID-19. So, what are your opinions regarding with acupuncture and COVID-19? Because I believe acupuncture has the ability to help at least. So that is why this is I wanted to know your opinion about that.
So I'm really glad you asked. I have to say that COVID-19 is not my area of expertise, but I know acupuncture works a lot for increasing white blood count and for immunocompromised patients and for immunity. It helps boost immunity, and we have evidence for that. There's a lot of research, a lot of articles for that. And so if you just go to PubMed and you give it a little read, um, and you can scan those articles, which I recommend you do that, you can know, and there's actual points that you can, like, there's stomach 36 that we all know that improves immunity. And so I would recommend getting acupuncture, or if you're not willing to go outside, or if you're any condition that you're not going outside, which is completely fine, do at home moxa, do at home acupressure, which is part of our job is explaining and providing learning skills to our patients and to the population to protect themselves and improve the immunity. That would be in one hand. Moxa would be amazing in stomach 36. There's a lot of points, but that's the first one that comes to my mind, obviously, because it's so common. And then number two, I would also, I know that there has been a lot of people with COVID-19 that had anosmia, so smelling issues afterwards, after having COVID-19 symptoms, or as part of their symptoms, and they still have it. And so I have a patient that had COVID like 7 or 8 months ago, and she still has difficulty with smelling. And so we can provide a lot of acupressure as well. We can tell them to stimulate. There's a lot of we have extra points and actual points surrounding the nose and on the cheeks and on the sinuses that we can provide even with gua sha massage and with acupressure. If they're going to the clinic, we can put a lot of acupuncture needles, and that really helps with the smelling situation that has been going on with COVID. So those two specific things, I can say that we have evidence and research for that. The other things, I would not feel comfortable talking about them because we don't have enough research, but for those two, we have enough evidence.
Sure, ma'am. I have taken note of the each and every point so that I can help the patients who comes to me. And it's such a you gave us a guidance that acupuncture could help with the COVID-19. So I would definitely try that points and everything. And one question is from my side that how
Sorry,
do you
let
keep?
me interrupt you. Sorry,
Sure,
just
ma'am.
add
Sure.
a little thing. So I think it's really important to say that if done by an acupuncturist, because we know that
Yeah,
there's
yeah.
people out there that practice acupuncture that are not acupuncturists. So if you are a provider and deliver a good acupuncture treatment, there are no side effects to it. So that, because people with COVID-19 and people in general are concerned with always having a secondary effect. So it's always good to teach and to express that acupuncture has minimum, almost none secondary effects, which is a good thing compared also to medicine, right? Or to taking a medicine. So we always have to say that there's no side effects of putting needles in your, if done by an acupuncturist in a specialized hand, or acupressure or massage. If you are in good hands, there's no way of going wrong.
Definitely, ma'am. I will totally agree with your point that acupuncture is. I even myself believe that the acupuncture is the most popular, should be most popular because there is no side effects in it. Ma'am, one question is
Exactly.
from my side is that how do you keep up with the latest researches these days? Because day by day there is coming up, and in acupuncture there is so many researches that's doing nowadays. So how do you keep yourself up with all these researches?
I think that's one of the most difficult tasks. So, what I do is I follow a lot on Instagram and Facebook. And also, I try to read in my spare time. So, I did an interview the other day and they told me, "What do you do with your spare time?" Well, I do a lot of things, like I like to walk outside, get some fresh air. I do yoga, meditate, but I also, on my free time, they told me, "So what's the latest book that you read?" I'm like, I don't read books because I try to keep up with the research. So what I read is not books. I try to read books, but they're all related to acupuncture, or they're all related to TCM or Western medicine. But I usually, every day, I try to read at least one research, um, because I think it's so important for us. That's the way we're going to grow, because Western medicine is bigger than us. And so the only way that we can try to convince them and try to be at their same level, it's with evidence and research. So we have to speak their same language, and we have to be able to know our research. And so I guess, so I follow a lot of acupuncture accounts on Instagram, and like evidence-based acupuncture and stuff like that. So they also remind me of, oh, look, there's a new article. So then I'm like, oh, I go to the link, and then, because you cannot, there's no way that one person can keep up with everything. So I use tools like following other accounts that are related to acupuncture, so I can know what they're talking about. like COVID-19. There's a lot of research now that there's no way I can read all about acupuncture and COVID-19. So that's one thing I do. I try to read one article a day, and I try to be engaged with people around the world that are also in the acupuncture world, because also staying in a group, and just as you contacted me, I've contacted other people in the world, and that is also making us stronger, like, oh, have you read this article? No. Oh, but did you get to this class? And there's a webinar. And I guess that's also the power behind us. We have to stick together, and no matter where we are in the world, with Zoom now, we can be all connected and get stronger. And I think research and articles are a way of us protecting ourselves and getting stronger. So that's my recommendation. And try to read as many as you can without interfering with your studies or with your daily life. Like, if you have extra time and you're like, oh, I'm going to watch TV, well, don't watch TV. Just make sure you read one article and then watch TV. It's not, I'm not saying that it's bad watching TV, but it's just like, try to read more before you do other things.
Yes, ma'am, I agree, because learning is, in a doctor's life, I believe that the learning should be continued, and you just are a great example for that, for us, that learning should be continuous. Then and only then you can keep up with the patients and everything. Otherwise, outdated doctors, no one could trust, as of my belief. And you set an excellent example for that learning doctor to us, ma'am. Last question from my side is, to nurture the budding acupuncturist, what will be your guidance? What will be your guidance to us, all the aspiring doctors?
I guess it's just a little bit of what we've talked throughout this conversation, Sam. I think we have to stick together and make a bigger group, a stronger group, by connecting with acupuncturists around the world. We have to provide evidence and research. We have to be strong on evidence. We have to be able to interact and have a serious and a medical conversation with Western medicine. They will take us more in account if we know their language and we know how to communicate Chinese medicine and acupuncture terms in their terms. So I think knowing and getting strong at your medical background is super important as an acupuncturist. Make sure you read a lot of research. Make sure, as the same way you're studying TCM, you have to study what is out there in the real world. It's not enough to know about wind and to know about the liver emotions. It's not enough. You have to be very prepared for the actual world, and also to get a job, to be in the clinics, to stand out for acupuncture, and to be really important in the acupuncture world. You have to know a lot of Western medicine. So I would say that's an important thing. And be strong also in social media. I think the one of our duties as acupuncturists is to uh, um, to show other people what acupuncture can do. So use whatever skill you have. Maybe it's TikTok, maybe it's just talking to your neighbors, but we have to educate people about what acupuncture can provide. And as we were saying, that it's a lot of efficacy, it's very efficient, it's it doesn't cost a lot compared to like a surgery. It's preventative, it's a treatment as well. So we can prevent and treat at the same time, which is amazing. I don't think there's other things that can do that except for our lifestyle, like exercise and eating well. So we have a lot of powerful tools behind acupuncture. We just have to educate people because there's not enough out there. So that is our duty. We have to educate people and share what we know about Chinese medicine and acupuncture.
Thank you so much, ma'am. You have given us such a great tips, and I think it would be helpful for all the who are listening to us, and all the one who are watching to us. You have such an inspirational journey, and we would like to connect you again in the future. So if we get a time, and if we get a chance, that we would like you to invite us in India and have a face-to-face session. But as current scenario, we are just happy with that you gave us a valuable time to us. But we in future, we are hopeful that we can connect with you again and again.
I would be happy to, and thank you again for inviting me. I'm more than happy to always connect. And hi to all, and thank you for listening, and thank you so much for your time.
Ma'am, we are glad that you gave us a time. It was such a nice
Okay,
session with you.
my pleasure.